Hello.
A warm afternoon to everyone. I
Thank you.
welcome everyone to the second episode of Learn from Leaders series. Today's episode, Preparing the Society for Mitigation, is being conducted by AP Goyal Shimla University in collaboration with Venkateshwara Open University and Sri Venkateshwara University. After the year 1918, the world was taken aback by yet another virus in 2019. On December 31, 2019, China informed the World Health Organization about the cluster of pneumonia cases in Wuhan city, which subsequently spread to other countries as well. Initially, the virus was named as a severe acute respiratory syndrome, coronavirus 2. Some media reports also called it the Wuhan virus, and now the disease is named COVID-19. COVID-19, after being announced as a pandemic, was century's largest public health emergency ever witnessed. India, being the largest democracy, has been hit by the first wave and now is witnessing the second wave of COVID. It has deteriorated physical and mental health of multiple people across the world, destroying many families. Yet, another cyclone of COVID is expected to start in India with the third wave. And it is very important for us to understand the precautions and certain safety measures that could be followed to mitigate COVID. On behalf of the university, I take extreme pleasure to welcome Dr. Rajan Sharma, former President IMA, Dr. Vimal Vishambar Rai, Head of Department of Pediatrics, Sri Agarsen International Hospital, New Delhi, Dr. Ashwini Sharma, Bureau Head Outlook HP, the moderator for the webinar, in the gracious presence of Professor Dr. R.K. Chaudhary, Vice Chancellor Venkateshwara Open University and Pro-Chancellor AP Goyal Shimla University, and Honorable Vice Chancellor AP Goyal Shimla University, Professor Dr. Ramesh Chauhan. Before proceeding further, I would like to introduce our guests for this episode today. Our main speaker for the episode is Dr. Rajan Sharma. Sir, I welcome you here on behalf of the entire university. You are the former president of Indian Medical Association, and you have been associated with AP Goyal Shimla University since a long time. You have been actively involved with different activities of IMA since 1999, and you have started taking proactive initiatives in the working of IMA Haryana State Branch. Your baptism in IMA started during the early age when your father, late Dr. J.P. Sharma, led the local IMA Haryana State and later organized Medicon in Yamunanagar. Sir, you have been involved in many social activities apart from medical practice, and due to the involvement of your active involvement in different activities, you have achieved many milestones, out of which few are: Haryana is the only state where exemption from Clinical Establishment Act has been granted to hospitals less than 50 beds. Haryana is one of the few states where a district medical negligence board has been constituted, thus ending the terror of police complaint and arrest in negligence cases. Haryana is also the third state where an act for violence against doctors came into existence. These achievements have come with the ongoing efforts of successive teams, but the foundations were laid during your tenure as the State President, Haryana State Branch, Indian Medical Association. You have served the association as member of Central Working Committee, as President, IMA Jagidri, and President of Haryana State Branch for more than 2 years from 2011 to March 2013. You have also served as the director of IMA A.K.N. Sinha Institute of Medical Sciences. You were a member of IMA HPI in 2016 and a coordinator of Beti Bachao program of the North Zone. Sir, on behalf of the university, I take extreme pride to welcome you here today with us. We also have with us Dr. Vimal Bishambar Rena, who is the head Department of Pediatrics in Sri Agarsen International Hospital, Rohini, New Delhi. Sir, you have also have the experience of working as a visiting associate of the Professor of Pediatrics with World College of Medical Sciences and Research, Jhajjar, Haryana. You have worked intensively in NICU and PICU since the last 25 years in different capacities, along with ventilation and tertiary care support. You have also developed interest in pediatric pulmonology and adolescent medicine. During this phase, you have worked in rural areas of Northwest Delhi and bricklane workers in Jhajjar district, Haryana. Sir, we are honored to have you here with us today.
Thank you.
With this, I would also like to welcome Dr. Ashwani Sharma, who is the moderator for this episode, a senior journalist with 30 years of experience in journalism, and you have recently taken to your credit a PhD degree from mass communication from the University of Himachal Pradesh University. You have been the former bureau chief of Indian Express. You have 30 years of experience in journalism with several awards. You have widely traveled the world. You have now been working with the Outlook magazine, and you're also a guest faculty at AP Goyal Shimla University, helping students and many young budding journalists with their internships and placements. Sir, I welcome you on behalf of the university. With this, I would like to invite Honorable Vice Chancellor Venkateshwara Open University and Pro Chancellor AP Goyal Shimla University, Professor Dr. R.K. Chaudhary sir, to please deliver the welcome address.
Prachi, what we will require to do, actually, Dr. Rajan Sharma has not been able to join because of some technical problem. So now he is joining because he has been asked in email ID, and you see, we all are sitting at a different locations. Naturally, I was communicating with Swapnil and other things. So Swapnil has confirmed me, and he has also confirmed me that he has is going to join. And Dr. Rajkumar Jha is also, perhaps he has joined or not, I am not able to track, but he is also in the queue. So my address, can it be at the last of the this thing, because let the Rajan also join. I take this opportunity for the time being to welcome Dr. Bimal
Thank you, sir.
Rana Sahab. And
Thank you, sir.
I'm very thankful. In a simple request, he has agreed and he has obliged all of us. And he's a very noble and gentleman, and a doctor and then pediatricians, which is the reason behind to invite him is one of the biggest reason that somehow we have noticed the news and media coverage that the children is going to be most vulnerable in the third COVID wave. So I thought that this is the time where he is the person, he is the right guy to enlighten us and to give us some framework or some guideline or some pathway to move on. So without taking much of the time, because you see that a lot of people are already online and looking us, by the time Rajanji is joining, I'm over to Dr. Bimalji for his enlightenment. Thank you, sir, and welcome. We will again, at the last, we will welcome and express our gratitude in the last of this.
Thank you, sir.
I'm over to Dr. Bimalji. I am over to Dr. Ashwani ji. Sorry, he is the moderator only. So sorry, sir. Dr. Aswini will start your program.
Good afternoon, sir. Good afternoon. It's okay. Malay, you are the leader of the university. You have been the inspiration, and you, when we were discussing this topic, and we were discussing the topic.
Dr. Rajan Sharma ji has already joined. Perhaps I have
most
been
welcome.
informed.
Most welcome. Most welcome. So I was recalling when we was talking over phone, and good afternoon, sir. Dr. Rajan.
Good afternoon, everybody.
Good afternoon, Dr. Rajan.
Most welcome, sir. Most welcome. So I was just recalling when Dr. Chaudhary spoke to me that we are organizing the seminar, and now when second wave is already on and it's though subsiding, but there are fears about the third wave already, and the medical experts, they are cautioning the public, they are cautioning the government and sending messages across that we should remain prepared, and there is a need for a massive preparations. So with those things, we finalized some topic that how mitigation measures, what should be our response to this new situation. So with these words, I welcome Dr. Rajan Sharma, who has just joined, former president of Indian Medical Association, Dr. Bimal Raina. We have heard a lot about both of you, sir, and it's our privilege that you are with us, and we'll have a huge audience to listen to you, because there have been a lot of fears, and the fears are not only because the situation we have seen during these days, the fears that the wave which we are expecting after this is going to affect our children. So every parent is worried as what kind of preparations the government should make, and how parents should avoid beating this problem which is coming up on their head. So all these things, I think it's the time for the experts to speak, and we are the just journalists. We have been reporting these things. We don't try to interpret. There was a joke recently. Somebody asked a journalist, somebody asked a doctor, when Dr. Sir, when this wave of pandemic of COVID is going to end. So he said, I'm not a journalist. So that kind of things are already there, but we become expert on everything. But we have very reputed experts with us, and let's listen to him. And at the end, we'll have some kind of question answer, or the issues which I want to bring out from the experts. We will try to get that. And I think we'll start with Dr. Rajan Sharma. Though I'm told he was not well, and still he has managed to join us. We are greatly honored, sir. So let's begin with your views, sir, and let's enlighten our audience, and we will get benefited out of it. Thank you very much, sir.
Respected Chaudhary Saab, Dr. Professor Ramesh, Ashwini, Dr. Vimal, and everybody has, first of all, a very warm good afternoon.
Good afternoon, sir.
So the topic of today's discussion is the third wave. But I am more worried. I always live in the present. You ask me, how many years will I live? Nobody can predict that. Second wave is yet not gone, and we are inflicted with the menace of black fungus, white fungus, orange fungus, and whatnot, and being not prepared fully for it. Dr. Vimal will agree with me.
Yes, sir, I do.
That we are under extreme battle fatigue. All of you have read the newspapers today. Working 24/7, 48 hours, without breaks, without any proper facilities. Today in extreme frustration, so many resident doctors of Madhya Pradesh have resigned.
Yes.
I am not worried about the second wave, third wave, or fourth wave, because this virus has a wavy pattern and it will take some time to go. So why now the I'm worried about the situation where doctors will not be there. Do you know, Dr. Bimal will agree again with me.
Yes, sir, I do.
Sir, how many ventilators do we have, sir?
Sir, we have around 10,000 ventilators. More than that, I would not have a specific answer to that.
I will tell you.
Yes, sir,
We have
please do.
hundreds and thousands of ventilators waiting there at the airport.
But we have no doctors for that. We have no staff for that.
And no doctors and nurses.
Yes.
Warnings were given, especially by me as a past president, ki please, you are trying to get ventilators. Which type of a ventilator are you going to get, and how are you going to train the staff? It is not a blame game. See, sir, I'm frankly telling you, a university or a medical college is always run by medical practitioners. I have become a doctor today. Okay, fine. God has been kind. I became a so-called medical doctor, politician. But I'm an orthopedic surgeon. So I always give credit to my teachers.
Yes.
But when losing 1,093 doctors,
Yes.
it frightens me as a, because even if I have not anybody,
Yes.
English is okay or Hindi mein bolu?
I think you can go ahead with the English and
English is
both.
okay. There are a lot
It's
of
okay.
international
मुझ
students.
में वो डॉक्टर में इतना डर लगता है. पिछले साल जब फर्स्ट वेव आई और हम 747 डॉक्टरों को खोया, I myself went into depression. अरे यार इतने जा रहे हैं, and then top of it, nobody is bothered. And I have a very, very pertinent question to ask. एक डेथ डॉक्टर डिक्लेयर करेगा, आपको कोई भी प्लानर वहां डेथ डिक्लेयर करने के लिए मिलेगा? क्यों डॉक्टर विमल?
सर बहुत ही मिजरेबल सिचुएशन.
रेजिडेंट डॉक्टर्स पता क्या कहते हैं? कहते सर हमें ये डर लगता है, हम डेथ डिक्लेयर करते हैं, हमारे मुंह पे लड़कियां तक बेचारी हमारी बच्चियां हमारे मुंह पे तमाचे जड़ दिए जाते हैं. कहता अब हमें ये कहा गया है डेथ डिक्लेयर करो और भाग जाओ. असम में वायलेंस हो गई, डॉक्टर को पीट के कपड़े उतार के पीटा गया. मतलब हो क्या रहा है?
आसाम, कर्नाटक.
असम की बात कर रहा हूं मैं. और उसके बाद कहते हमने एफआईआर दर्ज कर दी. अरे वो एफआईआर करेगी क्या? यू जस्ट इमेजिन, वो लड़का सारी जिंदगी, पिछले से पिछले साल वेस्ट बंगाल में डॉक्टर के खोपड़ी में सरिया डाल दिया गया था ऐसे. He was aiming to become an orthopedic surgeon and now he has become an epileptic. एक डॉक्टर कितनी जाने बचाता है? क्या किसी ने सोचा कि हम आज 1100 डॉक्टर मर गए, हम तो एक आंकड़ा भी नहीं है. वैक्सीनेशन किसने बनाई? आप यूनिवर्सिटी खोल के बैठे हैं, आप किसी को मैनेजमेंट प्रोटोकॉल बता रहे होंगे, किसी को बायोटेक्नोलॉजी बता रहे होंगे, कब किसी को कुछ बता रहे होंगे, और हम एक अज्ञानता की तरफ जा रहे हैं. हमारा एक भद्दा मजाक बनाया जा रहा है कि जी 1100 डॉक्टर जो अपने आप को नहीं बचा सके वो आपको क्या बचाएंगे. अगले दूसरा आता है डॉक्टर टर, तीसरे दिन आता है 11,000 डॉक्टर मर गए वैक्सीनेशन लगवा के. So that spread of fear of vaccination. Let me remind everybody in this house, the first guinea pigs of the vaccine, which was not ever tested anywhere, were we doctors and healthcare professionals. Isn't it, Dr. Vimal?
Yes, sir, absolutely right.
We took that risk and we went in.
Yes.
And under the garb of ancient literature and everything, we respect our elders. Everybody has grandfathers, fathers in our house. We don't respect, we all respect them. But making a fun of a vaccination to which our honorable Prime Minister has allocated 35,000 crores. Can I ask a very big question? Why did the External Affairs Minister go to America to get vaccination? And why is Kamala Harris, the Vice President of America, calling up our honorable Prime Minister today? Don't worry, we are with you in this fight. This thing was on the table for which we all doctors were warning. Oxygen shortage was not our problem. Today, medicine shortage is not our problem. Vaccination shortage is not our problem. Lack of anti-black fungus drugs is not our creation. But when somebody dies, we get beaten. ये मतलब कोई सोचता है कि कितने मेडिकल स्टूडेंट्स के लिए ये डीमोरलाइजिंग है. We have a battle force जो रेडी है कि जो हमारा मेडिकल कॉलेज खोलो, हम जाके काम करने को तैयार हैं. But failure to decide. कभी वॉर जब छिड़ती है, आपने कभी किसी आर्मी कॉलेज को बंद होते देखा है? वह कभी यूनिवर्सिटी बंद करो. किसी जर्नलिस्ट ने मेरे को फोन किया, सर ये स्कूल बंद हो गए. और मैं कहा भाई, हम जब बचपन में थे वैसे ही 5वीं क्लास में तो पढ़ने जाते थे. Even if we waste 1 year, क्यों? If I am wrong, all the teachers who must be there, you can tell me. Even if you waste 1 year, what is the problem? Has anybody realized taking online classes of these small children is a big problem? I was virtually on this internet and these interviews last year. For 3 months, I didn't attend anything because I was sick and tired of it. And I am not an IT man. Rameshji called me in the morning. I said, I have a very severe backache. I'm sorry, but he's a brother and a friend, so I would never refuse him. So I took my painkillers and came here. But the nation has to go the scientific way.
Yes.
And I will now specifically come to one point without maligning anybody. I respect Ayurveda, Siddha, Unani, any discipline. But you are all research scientists. The amount of India is known as a leading hub of medical tourism, international medical tourism. हम अमेरिका में लीड करते हैं, यूके में लीड करते हैं, सारी कंट्रीज में लीड करते हैं, और अपने इतिहास का तो कोई मजाक उड़ाता ही नहीं. हम कितने लोगों के घर होंगे जो हमारे बाप दादाओं ने बनाए होंगे, तो हम क्या जैसे ही पैसा आया कहते तोड़ दें ना. मेरा घर मेरे पिताजी ने बनाया था, मैं तो आज भी इसको प्रिजर्व करता हूँ कि नहीं, दिस इज माय लीगेसी. बट प्रॉपर रिसर्च डिडंट गो टू इट. किसी को गलत कहना से पहले उस पद्धति को पढ़ो. मैंने सुश्रुत संहिता सारी पढ़ी. जो जेन्युइन आयुर्वेद आचार्य, मैंने जब उनको इंटेस्टाइनल प्रोसीजर समझाए, मैंने कहा अंतड़ियों की ब्लॉकेट के लिए आचार्य सुश्रुता ने कहा था कि पेट को काटो, अंतड़ियां जहां से ब्लॉक हो उनको काटो और उनके साथ लेके आओ और पूरी अंतड़ियों में शहद की लेप करके उसके साथ एक खास प्रकार की चिंटियां जिनके बड़े बड़े फंग होते हैं उनको लगाओ. जब वो फंग अंदर, इट वॉज ए वेरी एडवांस थॉट, बट उस पर रिसर्च किसने की? आज मेरा ओपन चैलेंज, आप में से कोई कराएगा ये प्रोसीजर? अगर कैटरेक्ट सर्जरी आयुर्वेदा संहिता में होती तो क्या माननीय धृतराष्ट्र अंधे होते और गंधारी जी को अपने आंखों पर पट्टी बांधनी पड़ती? विज्ञान अपनी जगह, आयुर्वेदा अपनी जगह, बाकी सारी चीजें अपनी जगह. वैक्सीनेशन का भद्दा मजाक उड़ा के अपने कमर्शियल इंटरेस्ट को बढ़ाने के लिए, और जब मेरे डॉक्टरों की मौत का उपहास किया गया, आज की डेट में मैं ओपनली कहता हूँ, हम अगर ये चीजें सारी बगैर पढ़े बन सकती हैं, हम व्यर्थ इतनी यूनिवर्सिटीज खोल रहे हैं, इतने मेडिकल कॉलेजेस खोल रहे हैं। माननीय प्रधानमंत्री ने 7-8 एम्स अनाउंस कर दिए। आज आपको बताता हूँ, नांदेड़ एसजीपीसी ने अपना पिछले 50 साल का जितना सोना है, पैसा है, चांदी है, जो भी वो है, सारा निकाल के एक स्टेट ऑफ द आर्ट सुपर स्पेशलिटी हॉस्पिटल बनाने का फैसला लिया है। उसी फैसले को देखते हुए दिल्ली सिख गुरुद्वारा प्रबंधक कमेटी, उसने भी ये फैसला लिया। हम अगर 5 ट्रिलियन इकोनॉमी की तरफ जा रहे हैं और हम ऑक्सीजन के लिए लड़ रहे हैं, अगर सबको पता थी, दुनिया को पता थी, सबको पता है सेकंड वेव आएगी, हमने पिछले साल 50,000 मैट्रिक टन एक्सपोर्ट कर दी। आज हमारे कहीं ऑक्सीजन सिलेंडर नहीं चल रहे हैं, कहीं कुछ नहीं चल। अब चलो सिचुएशन स्टेबलाइज होगी, हम काम पे लगे हुए हैं। अब ब्लैक फंगस एक नया चीज आई है, अब उसकी दवाइयां नहीं। तो ये प्रोटोकॉल वो सारी दुनिया को पता थे, हम आंख मूंद के क्यों बैठे रहे? और कॉलोनी अगर इतनी अच्छी है तो पैसे लेके क्यों? फ्री में बांटे, देश सेवा है। 1190 करोड़ का प्रॉफिट था पिछले साल, जो अब 246 करोड़ रह गए। तो बिजनेस अंडर द गार्ब ऑफ हिंदुइज्म इज नॉट इंडिकेटेड। एक परिवार में से एक डॉक्टर जाता है, मैं आपको बताऊंगा, हमारे डॉक्टर हरिहरन थे, डॉक्टर विमल जानते होंगे उनको, गुरुवायूर टेम्पल में सेवा करते थे और रात को वहीं रहते थे, एक बड़ी नॉमिनल सी सैलरी। उन्होंने अपनी बिटिया के लिए शादी के लिए 12 लाख रुपए इकट्ठे किए। उसी सेवा डिस्पेंसरी में सेवा करते हुए उनको कोविड हुआ, सबने मिलकर कोमैक्स में दाखिल कराया। उस बिटिया का सारा 12 लाख रुपया लग गया। आईएम इंडियन मेडिकल एसोसिएशन ने भी मदद करी, परंतु हम उनको बचा नहीं पाए। अब उस आदमी के सेक्रीफाइस को किसी सरकारी स्कीम में नहीं लिया जाता। आईएमए ने एक फंड, मैंने अपने पिछले साल में फंड क्रिएट किया था, आईएमए कोविड मार्टर्स फंड, इसमें हमने 10 लाख रुपए की कंट्रीब्यूशन परिवार को दी। और मेरा एक खुली चुनौती है सारे पॉलिटिशियंस को, कोई एक भी किसी डॉक्टर या नर्स या हेल्थ स्वास्थ्य कर्मी जिसकी मौत हुई है कोविड से, उसके घर गया है? सर, वी आर नॉट अगेंस्ट एनीथिंग इन द लाइफ। हम तो आराम से बड़ा, हमारे ना, हमारे को हमारे टीचर सिखाते हैं, बेटा जो मरीज में बाहर आता है ना, वो गुस्से और संताप में होता है, कुछ कह भी गया तो कोई बात। प्राइवेट में हम पैसे लेते हैं, इतने लोन लेते हैं, सब कुछ करते हैं, परंतु कहते हैं जाते जाते हमने तो लूट लिया। चलो ठीक है, कोई बात। एक बात सारे समझे, मुझे भारतीय इसको एंटी भारत फौज का ना लिया जाए। आई रिस्पेक्ट द इंडियन आर्मी, एयरफोर्स एंड एवरीबडी वेरी मच, पर एक फौजी शहीद होता है तो उसको रिट्रीव करने के लिए भी, या इंजर्ड होता है, डॉक्टर जाता है बॉर्डर पे, और अगर शहीद होके घर आता है, वो अपने साथ बॉर्डर की गोलियां नहीं लेके आता। एक डॉक्टर ही है जो बीमारी अपने घर लेके आता है। और कितने ऐसे एग्जांपल्स हैं जब हमारे अपने परिवार के ग्रस्त में, पर्सनल एग्जांपल मैं कहता हूं, मेरा खुद का परिवार, मैं, मेरी सारी दोनों बच्चियां, मेरी वाइफ, सारी संतप्त हुए इससे। भगवान की कृपा, चलो बच गए। और उसी को कहा जाता है जी ये सारी ड्रग्स जो हैं ये फेल हैं। अगर फेल हैं तो सारी कोविड केयर दे दीजिए। इनका चेला है जब बीमार होता है, ये ऋषिकेश दाखिल, सका भतीजा दाखिल होता है, बीमार होता है। जिस दिन डिबेट था उसी दिन मेरे को पता था, ऋषिकेश से डॉक्टर का मैसेज आया, सर इनका सका भतीजा हमारे पास दाखिल है। मैंने तो फिर सोशल उसके एटिकेट्स के हिसाब से उसका नाम नहीं लिया, दाखिल है। और ना कोई डिग्री ना कुछ ना वास्ता, आप कैसे इसको, अगर देखा जाए दिस इज अगेंस्ट द मोनोपोलीज रिस्ट्रिक्टिव ट्रेड प्रैक्टिसेस आल्सो। तो कल ये 4 मिनिस्टर बुलाओ और अपना प्रोडक्ट लॉन्च कर दो और बाकी डॉक्टर मरने को तो है ही। तो आज एक समय आ गया है कि देश को इस ब्लफ को कॉल करना पड़ेगा। या तो आप एक तरफ फैसला लीजिए, आज माननीय स्वास्थ्य मंत्री ने एक स्टेटमेंट दी है कि आप चुप कीजिए, दिल्ली हाई कोर्ट का ऑर्डर भी आ गया, परंतु आप ये देखिए कि इस ऑर्डर को लेने के लिए हमें कितना शोर मचाना पड़ा। आज की डेट में अगर आपकी यूनिवर्सिटी है तो गुरुकुल भी है। मैं तो सारी हिस्ट्री जानता हूँ। हमारे यहाँ गुरुकुल हैं जो हमारे माननीय आचार्य जी स्वर्गलीन हो चुके हैं, उनके तो नजदीक भी नहीं है, पढ़ाई लिखाई तो हुई नहीं। योगा सीख के तो कुछ नहीं किया जा सकता, नहीं मैंने सारे देश की समस्या ढूंढ ली है। अब हम ब्लैक फंगस से जूझ रहे हैं, सरकार कह रही दवाइयां मंगा रहे हैं। रामकिशन यादव ने दवाइयां भी ढूंढी है ब्लैक फंगस की। अब मेरा ऑब्जेक्शन क्या है, अब क्यों मैं इस एस्टीम्ड यूनिवर्सिटी में बोल रहा हूँ और मैं सारी अपनी बैकेट को भूल के आया हूँ कि मेरा युवा समाज ये जाने कि साइंस एक एविडेंस बेस्ड मेडिसिन है, और सिर्फ कह देने से भ्रमित ना हो, अपने सिम्टम्स को ना निगलेक्ट कीजिए प्लीज, और जल्द से जल्द अपने हॉस्पिटल पहुंच के, मोर्टेलिटी ऑफ कोविड-19 इज जस्ट 1.6%, और उसमें कहीं ना कहीं हमारे 1100 डॉक्टर की शहादत है और नर्सेज, और उनका नंबर मैं बता नहीं पाऊंगा। क्रिटिकल टॉक होगी। धन्यवाद आपका बहुत बहुत। अब डॉक्टर विमल विल स्पीक द clinical part.
Sir, very candid and very straight, and this shows the kind of your feeling and commitment to the profession. No doubt we lost very bright young doctors, experienced doctors, paramedicals to the COVID. And definitely, Dr. Saab, don't worry, these sacrifices are being counted and nobody undermines, and few things which you are telling that we should call a bluff, and I think the people are already calling the bluff. I think because I belong to the media has really exposed those people.
एक लास्ट चीज कहूंगा। देखिए, जो मैं जिस बारे में चिंतित था, अगर कल से आप मीडिया को फॉलो कर रहे हैं, परसों से यूपी और बिहार में वैक्सीन हेसिटेंसी शुरू हो गई, लोग वैक्सीन से भागना शुरू हो गए हैं।
सर, वो नदी में कूद के थे लोग। यस,
एंड इट इज नॉट मी हू सेइंग, मैं नहीं कह रहा हूं ये। आप मीडिया में किसी चैनल पे जाइए, कोई गेहूं के कनस्तर के पीछे छुपा है, कोई गेहूं के कैन के पीछे छुपा है। हमारा फियर यही था।
Yes.
That's it. Thank you so much.
So there is a multiple failures of agencies of the government, and the scientific advice, that's a fact, was not taken into account. Had that advice been taken, we could not have suffered this kind of a crisis. The ventilator problem, the oxygen problem, the shortage of beds, and then we are criticizing the doctors. They are not serving. It's not proper. Now we will take forward, because if we enter into this debate, it will go and go a long way. And now I call Dr. Bimal Raina, and just to throw some light on the points, what should be done now. We are in the present, definitely we will remain in the present also, but we have to think of the future also, because we forgot talking about the future and preparing about the future when the government was fighting elections, government was holding rallies. So we face this problem. So now we have to care about the future also. So we'll
Yes.
like to listen to Dr. Bimal and how we can stop this crisis if it comes, because there are reports that the wave will affect the children, and we want to listen to him how it will affect the children and what are the kind of protection we should be taking apart from the routines we are following. So we are avoiding going to the social gathering, hand wash and social distancing, COVID appropriate behavior, all those things are there, but need to be done now. And
Yes.
we like to listen to Dr. Bimal. Thank you very much, Dr. Saab, and we'll be really benefited by your views. Thank you so much.
So good afternoon to everyone. My regards to Professor Ramesh. Also, he called me up. Am I audible to everyone? Am I, sir?
Yeah,
Okay, sir.
absolutely.
My respects and regards to Dr. Rajan, sir. Always looked up to him. And I'll just come directly to the point. And if need be, I will speak in Hindi too, if you want me to.
Yeah, you can carry
Yes,
on
sir.
with that.
Sir, with your-
And Dr. Saab, sorry to interrupt. We'd
Yes,
like
sir.
to listen to you. What should be the role of citizens to?
That is what I
That's
will
very
come.
important now.
Yes, sir, I will do that. See, I will go. I will tackle the whole problem question-wise. The question is, what is the possibility of third wave of COVID-19?
Yes.
So we have to realize that epidemics come in waves. That is the history of the epidemic. They always come in waves. Eventually, everybody, most of the population, has to become immune. Either they are asymptomatic or symptomatic, but everybody has to become immune. This is called as the herd immunity. And a time comes when this wicked virus, it will slowly and gradually lose its steam. And either it will disappear or it will remain in small pockets within our population with a low transmission rate. So the third wave is definitely going to come. But there are many nuances to it, which I will talk about. So if we ask ourselves, we should be prepared for the worst and hope for the best. The whole system, be it the government, be it the healthcare system, everybody was overwhelmed by the situation we saw in the last 2 or 3 months. I mean, the tragedies will unfold over a period of time. We do not have time to think about and brood over that. At present, it would be wise for us to think that this is going to come, and let us all be prepared for it. Now, the second question that arises is, are children at greater risk in the third wave, as has been discussed in media, and Ashwini sir and everybody must be talking about it in the media. What happened in the first wave last year was that it was the elderly population and a population above 45 with comorbidities. Now, what are comorbidities? Comorbidities are hypertension, diabetes, and kidney disorders, obesity. These are comorbidities. So population above 45, 50 in the first wave, and the elderly were caught in the first wave, we know that. The second wave, we saw that the age came down, the cohort, the bracket came down, and the population that was affected was between 30 and 45. Young deaths happened. Now, the only age group that has not been affected a lot is less than 17 years, 20 to 17 years. But in the last wave, say around March, April, May this year, we have seen that approximately 10 to 17 year age group, 25% children were affected. Now, that is a huge group. And it is as much as the adults were affected, between 10 to 17 years of age. So it is going to come. Children are as susceptible as adults, and older children between 10 to 17 years. Less than 17 years, say the newborns and the smaller newborns, smaller children, fortunately, within their tracts, they do not have the receptors to invite the virus. The virus needs an invitation within the cells Unfortunately, the children do not have those receptors, the younger ones, and they are not much affected by it. So the question that again arises in our mind is, are children likely to suffer from more severe disease as witnessed in adult population? No, we don't expect that. 90% of children will be asymptomatic. In the rest of 10%, 1% children might be affected by a severe disease. And if we see that this wave, the third wave, is not going to be exclusive in children, it will be affecting those unaffected adults also, non-immune adults also. So if all of this group, the non-affected adults and the children in the third wave are caught by such a big tsunami as we saw in the second wave, then even 1% of population in the children getting affected, it will be a tragic situation. So as a people, as a healthcare system, as the bureaucracy, the government, I think we have learned a lot of lessons from the last wave, that we are being prepared for it psychologically, logistically, and otherwise. In my own hospital, we have had multiple meetings on this to prepare a protocol for tackling the third wave if and when it comes. I would not use the word if, when it comes. So we tend to forget that the children are not miniature adults. Sometimes we think that the children are miniature adults. The child is a different individual itself. We try to extrapolate adult symptoms into the child, but that is a big mistake to do. The way they react to a disease, or way they communicate, sometimes they don't communicate. Children can't communicate. They cannot tell you what is going on. So if they speak, sometimes they mislead you. So in this group of children, we are going to face more unique situations. One of the unique situations that we will face is, suppose a child gets, an adult grandfather became sick, उसको एक कमरे में दादाजी को डाल दो, वहीं बाहर टेबल लगा दो, वहीं खाना पहुंचा दो, kind of thing. How do you isolate a 3-year-old baby? How do you isolate a 7-year-old baby? How do you isolate a newborn? So questions will arise, and they will be very difficult to tackle. So as a population, as a people, because 90% of children are going to be almost asymptomatic, and more than 95% babies, if they get affected, will be in home care. So in home care, how do you isolate a baby? So we are facing a very unique situation, and protocols are being set up for that. Coming back to the question again, there are comorbidities in children also. The 1% children I was talking about, 90% will be almost asymptomatic. 10%, the rest 10%, 9%, we will be able to manage on OPD basis and all this, but 1% will become sick. And the 1% that can become sick can have comorbidities. A lot of children are diabetics too. And the diabetes in children, as you know, is brittle diabetes. You can control diabetes in an adult, but controlling diabetes in a child is very difficult. Obesity is one of the bigger comorbidities in the urban areas. One of the comorbidity is obesity. We are seeing a lot of variants in this. A lot of variants means even after you come RT-PCR negative, say after 17 days, the government says you don't even need an RT-PCR. But there is something which is called as a prolonged COVID syndrome that lasts more than, say, around 6 weeks. And certain children in Delhi, in certain hospitals, in Max Hospital, Shalimar Bagh, and in certain hospital, Gangaram also, the ICU at this time has children who are sick because of COVID. At this moment, the sick babies affected by COVID are going into the topmost nursing homes or the topmost hospitals that offer tertiary care. But if if we are not careful as a people, and if this wave comes as the second wave came, then having sick children around in small nursing homes who need generally tertiary care, we will have to be very much prepared for it. And how do we prepare for it? First of all, as Rajan sir said, get vaccinated, because you are going to be the link from outside to the child. So get vaccinated. Whatever vaccine is available to you, get vaccinated. Spread the message that you need to get vaccinated. Have no doubts about it. Vaccination is very important. Second, children will imitate you. You can't, हमारी दिक्कत ये आती है, हम बच्चों को हम उम्र मानते हैं, हम उनके साथ ऐसे बात करते हैं जैसे हम बड़ों के साथ बात करते हैं. The child does not have the IQ to process the information. 6 साल, 7 साल, 8 साल के बच्चे को मजाक समझ में नहीं आता. आप उसको कहोगे कूद जाओ तो वो कूद जाएगा. आप कहोगे यहाँ उंगली मत डाल तो वो उंगली डाल देगा. The child will imitate your behavior. If you continue to stress on yourself, do it yourself, having a mask, washing your hands, keeping social distancing yourself, then only the child will exactly follow what you do. Not talking about it. Mask हम बच्चे को 2 से 5 साल में भी लगवा सकते हैं. So we have to, जितना भी मैं स्ट्रेस इस चीज पे कर सकता हूं, जो कोविड अप्रोप्रिएट बिहेवियर है उसको कंटिन्यू करना पड़ेगा. बड़े बुजुर्गों को बीमार देखना इस लास्ट वेव में, इट वाज सो पेनफुल. ट्रस्ट मी, एज अ सोसाइटी बच्चों को बीमार देखना, इतना सिक देखना जितना हमने बड़ों को देखा है, हम बर्दाश्त, उससे हम उबर नहीं पाएंगे. We will not be able to get out. So it is very important, get vaccinated, follow COVID appropriate behavior. Third, इसमें मलेरिया, it does not work like a classical disease like malaria. बुखार आया और ठंड लगी, चद्दर डाल दी, ऐसा नहीं है. It can come with a simple conjunctivitis, आंखों का flu. It can come as simple vomiting and diarrhea in a child. It can come as a rash on fingers. So हमारे लिए it is very important to understand कि बच्चों में ये किसी भी फॉर्म में प्रेजेंट हो सकता है, और मैं ये पैनिक नहीं क्रिएट करना चाहता. Until and unless proved otherwise, कोरोना हमारे दिमाग में होना ही चाहिए. There have been, इस वेव में मैंने पर्सनली ऐसे बच्चे भी देखे हैं कि फैमिली इज टोटली कोरोना नेगेटिव एंड 6 months old baby is positive for corona RT-PCR. It has happened. इसीलिए जितना भी हम मेरा प्रणाम और नमन है सब टीचर्स को भी, जितना भी जो इस पिरामिड, सोशल पिरामिड के पीक पे हैं हम, we will have to take conscious steps कि हम इस चीज को फैलाएं. जो डॉक्टर राजन ने कहा कि everything has to be evidence based. Let us follow the protocols. Let us tell the people. Let us go beyond our daily brief to tell people who trust us. क्या आपने वैक्सीन लगा? आप इनबॉक्स खोलो, आप अपना कॉन्टैक्ट नो इनबॉक्स खोलो. सर आपने वैक्सीन लगाई? आपने लगाई? आपने लगवाई? आप नहीं जा पा रहे. आई हैव फाउंड सो मेनी यंगस्टर्स जो बुजुर्गों को गाड़ी में ले जाके उनका करवा के और वैक्सीनेशन करा रहे हैं. चिल्ड्रन, बच्चों की बीमारी हमसे नहीं देखी जाएगी. इसलिए बहुत जरूरी है हमारे लिए कि हम जो है ये मान के चलें कि ये वेव आने वाली है. मोस्ट प्रोबेबली हमें ऑक्सीजन की और इन चीजों की लॉजिस्टिकली उतनी प्रॉब्लम नहीं आएगी, क्योंकि we have a lot of it, but still we do not know how we will face the, उस वक्त क्या यूनिक प्रॉब्लम्स आएंगी. तो मेरे हिसाब से सर ये पहली बार ऐसा हो रहा है कि हमारा समाज, हमारी गवर्नमेंट first time the general public, the government is coming face to face with a virus and a healthcare situation. इतना करीब से कोई भी, हम भी नहीं, हमारे बुजुर्ग, हमारे my father is 80 years, कभी ऐसी वबा कहते हैं वो ऐसी कभी कोई चीज उन्होंने अभी तक देखी नहीं. इतना करीब से हमारी सिस्टम को मानो चैलेंज नहीं किया गया है. सो let us be wise in this. हमें एल्डर्स की, डॉक्टर राजन, सब एल्डर्स की उसमें गाइडेंस चाहिए. बट ये मान के चलें कि ये वेव आएगी, स्टैंडर्ड प्रोटोकॉल्स को फॉलो करें जो अभी तक हम करते आए हैं, कुछ नया नहीं है इसमें. हम वैक्सीनेशन जितना जल्दी अवेलेबल हो उससे मानो गेट वैक्सीनेटेड एज सून एज पॉसिबल. बच्चों में ये समझें कि उनकी साइंस एंड सिम्टम्स बड़ों से बिल्कुल अलग होते हैं. द वे दे रिएक्ट टू अ डिजीज इज टोटली डिफरेंट. एंड the pediatricians, the whole doctor fraternity, the healthcare workers, everybody is ready to face such a situation if and when it comes. Now, I will not use the word if again. I'm sorry for that. And Ashwini ji, I'm ready to answer any questions anybody has.
Thank you very much. You have rightly said that we should remain prepared for the worst, but we should be hopeful. We should
Yes,
look
sir.
positively. That's
Yes.
a fact. And the kind of things, sir, which you have told from your practical point of view, it's a fact that we will not be able to see the children dying. I hope
No, sir.
it should not happen. And yeah, that's because we live in a country where we have gods and goddesses. We wish that they also bless us. And now, because there is a process for preparedness, I am seeing some of the states, Maharashtra has taken a good lead in preparing for the third wave, and slowly some other state governments are also preparing, because now the responsibility is largely on the state governments. The center has really abdicated its responsibility, I'm sorry to say, but the state governments has to take a call. Yes, sir.
Sir, I just wanted to add to what Dr. Rajan was saying. The doctor does not understand the government. The doctor does not understand the bureaucracy. I can treat the patient on the bed. I cannot be looking forward where the oxygen comes from, where the medicine
Yes,
comes
that's
from.
a fact. That's a fact.
I cannot arrange a bed.
Yeah.
I can treat the patient on the bed.
On the bed.
I can give my everything for the patient on the bed.
Yeah.
And the public has to realize the doctor is not the profiteer. The doctor is not the black marketeer. The doctor is the soldier at the front. He cannot arrange medicines. He cannot arrange a bed for you. He cannot arrange an oxygen for you. I can only treat the patient on the bed. That is my.
That's true.
last-
And that's true. And Dr. Saab has really said that unlike the soldier, we carry the disease at home, we carry the infection at
Yes.
home. That's also a danger. Dr. Rajan wants to say something.
I want to ask a very, since Dr. Vimal was talking, and you were saying now the state has done, Maharashtra has done well. Are we Indians?
Not well. Maharashtra has started preparing.
Are we Indians?
Yeah.
So do we need to be divided into states? Why did we
No,
become
but-
a democratic Republic of India?
Sir, there has to be role models in the
No. This is not a role model, dear. This is not a role model. Whether my citizen is in Jharkhand, whether he is in Uttarakhand, whether he is in Delhi, whether it is in Haryana, the way ugly fight which erupted over oxygen
Yeah.
and remdesivir allocations. I can quote you examples that one particular district in Maharashtra saw shortage of remdesivir, and immediately a union minister intervened and it was sent. What I am trying to say is, we are all Indians and we are paying our taxes. A rich man's child is equally important as a poor man's child.
Yeah. Absolutely.
When we see the misery, you just imagine my colleagues, and Dr. Vimal will agree that in one night you are declaring 20 deaths.
Yes.
And it is
My-
also pertinent to answer, understand, as is anybody aware, he is aware, there is
Yes.
a central disease control
CDC.
body
Yes.
Pune, which is known as NCDC,
Yes.
which studies the epidemic control.
Yeah,
Ever since the epidemic has started,
yeah.
they have not even been called for a meeting. In frustration, they have
So
sent their
there are so many
recommendations.
issues. I'm telling you, if we start
They were
discussing,
not even
we'll
called.
go and go. So there have been lapses.
Even our
Yeah.
deaths were said, health is a state subject, but vaccinations you decide, remdesivir you decide. How can it be a state subject? Oxygen you decide. It is not a state subject, sir.
Yeah, that's what I was pointing out, that center is not taking the whole responsibility of the country.
And at the
There was
end
a
of the
one
day,
state, there was a one state which also imposed restriction that our oxygen will not go to Flana.
no, but in that same state,
Yeah.
3 oxygen tankers were stolen from the national highway.
Yeah.
So the question posed to me as a former IMA leader or doctor, sir, वो चोरी हो गए. I said it is a law and order problem, not my problem.
We have lot of questions now coming. People are really shooting the questions at us. Dr. Swati, I think, she has asked a question that how reliable is the home kit? I think Dr. Sab, you can reply or Dr. Vimal can reply. How reliable is the home kit which we are talking about for testing COVID?
I am at sea. Ask Dr. Vimal.
Home kit will only have a rapid antigen test. See, it works like this. If I have symptoms, if I have somebody who is already positive in my family, and I go and do a test, a home kit test, which will have a rapid antigen test. Suppose it comes negative. Should I find solace in that? So this is how it works. If the test comes positive, you are supposed to believe it. If it comes negative, you have to take the second step. The second step is you have to go for an RT-PCR. If RT-PCR comes negative, but still you have a suspicion, then we have to go for a CT scan test, which might be positive, classically positive, even if your RT-PCR is negative and your rapid antigen test is negative. So only the positivity of that test is important. A negative test will not hold water.
Now, sir, there is also a question that the children, I think of certain age, are not supposed to wear the mask because it affects the oxygen and all. And what is the right age for the children that they should be wearing the mask?
Yes, sir, that is a very valid question. It is not only whether I have seen children as less as 2 years, the mother removes the mask and the child again wants the mask because it's play for the baby. IAP, Indian Academy of Pediatrics, has come up with guidelines, and they have said that 2 to 5 years, 2 years is the age where you can start applying the mask to the child. And between 2 to 5 years, you can train the baby to wear a mask. I have seen the children from 2 to 5 years wearing their mask more properly than I do at times. So I think 2 years. 2 years is a good age.
Okay. And then there's a question, sir. When you start noticing some symptoms in the child, at what stage the parent should go and get the child tested for the COVID? And what kind of test they should be opting for?
Should I answer that?
Yeah, please.
Okay.
You only have to answer.
When there is
I'm a mute spectator.
No, sir.
Science is totally to you.
We'll also bring you here. Don't worry.
Sir, you cover our backs. That is, we are very much thankful for you, sir. So what happens is, the mistake that we make is, my child has symptoms. When should I get tested? Where should I get tested? The first thing that is very important is the test should be advised by your pediatrician or a healthcare worker or a doctor. Don't go in mind with the fixed notion that you have to get tested. Okay. If possible, talk to your pediatrician, talk to your healthcare worker, go to the nearby dispensary, and as soon as possible, if you see any symptom in your child, it does not work like, say, in typhoid or dengue, you have to wait for so many days of fever. Because when the symptoms start, you already have had 2 to 9 days of incubation. So the test will come positive if you are positive. So as soon as you see the symptoms, the next step you take is go to your doctor and leave it up to him. Most probably he will get you tested. As I said, symptoms is not just fever. A baby can, a 5-month-old baby, 5-month-old baby, that might be refusal of feed. The child might not be playful. You have to have your antenna. Might not be breastfeeding, suckling properly, or that might be slight cough. So you should be in knowledge of these symptoms that can appear anytime in your child, and that is when you take a medical opinion. The doctors are open now, the clinics are open, the teleconsultation is there. So as soon as possible, take the opinion of your doctor rather than thinking that I should get a test done, because then the onus is on you. If you come to me with symptoms, the onus is on your pediatrician, the burden is on me. If you go and get yourself vaccinated, and if it is a false positive, false negative, the child has corona, but the test was not properly done and it comes negative, then what you will end up in is, you will end up in false sense of security till the child becomes really sick, and the golden hours, the golden days of 48 hours, first 48 hours when you should get intervention, that will be missed. So don't bypass the doctor or the healthcare worker. Go to your doctor.
Yeah, and there's a question out of your answer also, sir. Should a COVID positive mother be breastfeeding a child who is not so far tested for any COVID symptoms?
Absolutely, the mother should breastfeed the baby. See, mother, if the mother is RT-PCR positive, the mother is COVID positive, and the baby is a newborn. So we are talking, because the baby breastfeeds till 2 years, 2.5 years, 3 years, that is what is recommended. Suppose the baby is a newborn child. The problem of the baby getting COVID by breast milk is very low.
Okay.
Initially, we had an apprehension.
This is a really important piece of information.
Yes, sir. The baby has to be breastfed, and the baby can be kept in a crib 6 feet apart from where the mother is. If possible, there should be an attendant who wears all the mask and the kit to help the mother if she is post-cesarean or still needs help. But the baby can stay in the same room, 6 feet away from the mother, and breastfeeding has to be given. Yes, sir.
So there's a question from one of our participants. She is a teacher in the journalism department, Vijayshri. She wants to ask whether the diabetics persons, if he infects the COVID, what are the complications he is going to develop after having been cured for the COVID? Are there high chances of complications?
Post-corona, really the studies are going to come. Complications, because it is more an adult subject, I'm a pediatrician, I would not know, but still, I will try to answer that as much as possible for me.
Yeah.
Problem is, one, during the disease itself, because we end up giving steroids to these patients.
Yeah.
Diabetics are comorbids, they have a higher risk. End up giving steroids, and when you start giving steroids, the sugar shoots up.
Yeah.
There are going to be certain complications, certain brittleness. मानो जिस तरह से जितनी डोज पे इंसुलिन हो या ओरल एंटीडायबिटिक्स ले रहे हो, उतनी डोज से ज्यादा की जरूरत पड़े. It is very much possible. But one significant thing that we are seeing in different studies in diabetics and otherwise also is that we end up with cardiac complications. 2 to 6 weeks after you totally heal, it is very important to consult a cardiologist, because diabetics already are cardiac compromised. And COVID infection itself and the therapy that is given cannot prevent the cardiac complications per se, even in non-diabetics. Certain people have had sudden death. ये almost एक बीमारी ऐसी है कि अगर आप हॉस्पिटल में 20 दिन भी निकालते हैं तो जरूरी नहीं है कि आप ठीक हो रहे हैं.
Okay.
You are as bad as you were on the first day. You are possibly more worse than you were on the 10th day, and you are more worse on the 20th day. So you are not out of woods. ये बाकी बीमारियों की तरह नहीं है कि आप जो है 7वां दिन हो गया अब ठीक हो रहे हैं, 10वां दिन ठीक हो रहे हैं. नो नो, पीपल हैव डाइड सडन डेथ्स. एंड जैसे अब स्टडीज आएंगी, जैसे क्वेश्चन था डायबिटिक्स के लिए, कार्डियक कॉम्प्लिकेशंस इसके साथ काफी रह रही हैं. सो दे हैव टू बी वेरी अवेयर ऑफ दैट.
So Dr. Rana, there is an underlining principle that we should protect ourselves, we should protect others from the COVID so that we don't get infected. So here is a question for Dr. Rajan also coming up. Dr. Rajan, somebody has just posted a question that there is a perception among a section of people that liquor sometimes prevents the COVID, means coronavirus infection. Is it
I
true?
refuse to answer this question.
Sorry?
I said neither me nor Dr. Anna will answer this question. It is to your wiseness. But yes, augmenting Dr. Vimal's last question, I would like to say,
Yeah.
diabetes, hypertensive people, I have a folded hand request. Don't visit untrained doctors and quacks and start taking steroids, neglecting your symptoms, and then reach us. This is creating a lot of problems.
Yeah. So I'll also ask the participant if somebody is just a minute, sir. Any participant,
Yes, sir.
if you want to ask direct question to Dr. Vimala, Dr. Rajan, Dr. Chaudhary is raising his hand. I think he wants to.
No, but you ask your participant what made him ask this liquor question to me and why not to Dr.
Sir,
So I'll
he
ask
is rich.
behind the camera. Behind the camera.
He is
I'll
rich
pose
enough
this
to use
question.
it as a sanitizer. He wants to use it as a sanitizer. He doesn't use
Uh,
to drink it.
Dr. Rana, another question which
Yes, sir.
coming to my mind, that you were
Yes, sir.
talking about treating the children, how they should be treated
Yes,
and where they should be treated. But a large section of children or a large section of population are in the rural areas. They don't have
Yes,
the
sir.
resources to reach a good hospital or a good doctor. What is
Yes,
your
sir.
advice to those section of people? Because now the intensity of the COVID was much higher in the rural areas. For example, I'm in Himachal.
Yes, sir.
It's a huge. So what is your
Absolutely.
advice to that section of people?
I do not know if I advise them, how is my advice going to reach them? This
We'll
is
take it further.
this is how. Yes, that is what I'm talking about. See, what works for the goose works for the gander. You know, what works for in the urban areas works for the. Dr. Rajan said, every child is important. It doesn't matter whether he's rich or old, urban or poor. This is the missing link we have had, because at this level we have never come in face to face with this medical situation. This is where the teachers come in. This is where Sir Ashwini sir, journalists come in. This is where we will have to think out of the box how to reach the areas where the virus is still waiting to go, because it is a very smart and a wicked virus. It will reach eventually. And I think the missing link is the non-medical professionals, the journalists, the teachers, and the government. The government should have updates on radio, the mass media, telecommunications, having posters, having the ASHA workers, even the post office guys. We will have to prepare ourselves. The maximum thing that will happen is that we are also well prepared, and it might not come. That might be a blessing in disguise, that we are able to reach people.
I'll bring in Dr. Rajan again here. There's a question that somebody tried to ask that.
But I will first like to answer the question which was not Dr. Vimal's domain.
Okay.
And he was a bit cagey on that. I'll bite the bullet.
So there are a lot of talks that.
No. When our Honorable Prime Minister says, "Jab tak nahi dilai mask, jab tak nahi dilai mask hai zaruri." And suddenly there was a false sense of security being created over the past few months.
Yeah.
That we have won over COVID. Elections were held.
I
was
spoke about
concerned.
I
held.
spoke about that.
21 lakh people came. They became the super spreaders.
Yeah,
At some point, this fallacy was understood and it was called up. Now make it symbolic. And
So
same
many
was true.
teachers,
Caution was thrown to the winds
yeah.
in
teachers
the
died. So many
elections.
teachers died.
This panchayat polls in Uttar Pradesh. Now we
Teachers
have
died.
cancelled. Why were they allowed?
Sir, why
These have
should
been
we
the super
forget?
spreaders.
Why should we forget the Kumbh?
I said at Kumbh Mela,
Yeah,
21 lakh people. One lady,
Yeah.
67-year-old, infected 33 ladies.
yeah,
I said, I am not forgetting the Kumbh.
yeah.
But let's not take it as a religious issue. It is a scientific issue.
Yeah.
And on one hand, you are saying, अगर है जरूरी तभी निकलना घर से जरूरी. और आपने 21 लाख लोगों को हरिद्वार भेज दिया उठा के. This is something very wrong. Now I come to the second question.
Yeah. The second question is that some people see it as a conspiracy of China to send a lab some virus to the lots of countries. Is that true? I think you are the most approved person to reply on that.
See there, now that is long over. Indian variant has also come. The world over it is spreading. Why would China fight this war with us only? America, Indian.
Now we are getting emergency devices from China.
It was already coming in the black market, sir.
Yeah.
You don't know?
We
It never stopped.
uh,
Atmanirbhar Bharat did not produce any ventilator.
yes.
I'm very sorry to say as a doctor not to be construed on the political lines, but the fact remains everybody, Soumya Swaminathan, our Pride of India WHO chief, she was appointed as a scientific advisor to the government of Great Britain. AstraZeneca, when it was introduced at 2 doses, suddenly they realized there is a very big spurt in number of positive cases. So immediately the scientific community came together and decided no. Instead of giving 2 doses, we will wait for the production to jump up. Let's give one dose to everybody. And it happened. Now, we were creating a vaccine. We know we are a country of 130 crore population. We understand the constraints of the government. But who was advising you to suddenly introduce for the youth?
Yeah.
Youth was the biggest super spreader which was known.
Sir, the Supreme Court has already.
Slots are closing in 5 minutes.
Yes.
And then it again become political.
Yeah.
My only humble submission to the entire political diaspora of the country is, please let scientists, doctors, thinkers, and hospital planners decide this protocol. Let all the best of brains come out. Rather than, do you ever see any DGHS, any Directorate Service of Government of India, or any scientific? Only once when I objected, he came on TV. It is always a political statement. Now this compensation, suddenly this orphan children have become a very big political issue. Now it is coming that this minister is announcing 1,400 rupees per month to the child. And it will go, I don't know.
Yeah.
Let's get our act together as a nation. We have enough of scientific brains. Maybe a person in your university would come out with some this thing. A nursing college girl from today in Sirsa or somewhere in Haryana has come out with a bioethical sheath to protect against COVID.
Okay.
Subjected it to a scientific protocol. All these youngsters who are sitting in front of us, they know much more than us. My speech though is rhetoric. I know what I have to say. And I read a lot. But the fact remains, young talent has to be trusted. People are coming out with it. We are the world's leading vaccine manufacturers. We have to think. We cannot augment. And 130 crore people, sir, another thing which Dr. Vimal will agree with me. Calculate, I always used to say, don't bite the media bullet. When I was in office, I was told by one of the seniors, Dr. why? I said, do you know, realize to do RT-PCR testing of 130 crore people, how many years it will take you?
Yeah.
18.5 years. And same is true for vaccination. Identify containment areas, identify high intensity areas, at least make a buffer stock. I think they must be doing, they are enough planners. But one objection which I still have is nobody has said I am at fault. It was my planning which has failed.
That won't come,
I
sir.
would say if I would have been in his place,
Yeah, that won't come.
I would have in his place, I would not have let these the deaths happen.
I
Because-
read some statement. They have already started again claiming that now we have tried to deal with the second wave very
Okay.
effectively.
I leave it to the wisdom of the house.
Yeah.
Please go and see, is there a national task force for COVID? We had a national scientific forum for COVID and the senior most scientist resigned the third day.
Resigned. Yes.
I'm not mistaken, his name was Dr. Jamil.
Dr. Jamil, yeah.
So, scientific temperament also visit. When did our last Indian Science Congress happen? विमान तो रावण जी सीता जी को लेकर लंका में गए थे, पर आज तो हम एयरबस और बोइंग में जाते हैं. History is important.
Sir, with a lot of meaningful talks, meaningful views have come, and the message is that we should have a COVID appropriate behavior. We should get vaccinated, and the scientific brain should work, and scientists should be listened, and there has to be a responsibility. If there is a failure, there has to be responsibility. I'm talking of the government, not of the doctors. Doctors are doing marvelous job.
Another thing, sir, I'm sorry to interrupt. Another thing, people must realize, don't subject us to violence.
Yes.
Don't subject us to violence.
Yes.
It is creating such a scare amongst us.
It has to be dealt very effectively, and I think somebody should take a responsibility of not protecting the doctors.
No, despite epidemic act being in place, my doctor, she's doing daughter, she's doing MBBS. She says, I don't want to stay in this country. You just imagine if you're going to send the entire talent there, where are we heading for? Somebody has to address this issue of manpower immediately by making it a crime. Still people do it.
Okay. So we are running out of time now.
Thank you so much.
Coming. So I really thank both our guests. We have really enlightened with their views, and we'll take it further. We'll publicize it. We are posting this recording on our website and our social media. I think people will get a lot of benefit out of it. Dr. Bimal, Dr. Rajan, thank you very much. And I just forgot to mention our Vice Chancellor, Dr. Ramesh Chauhan, is also there. He has been listening to the entire discussion. So I'll invite Dr. Ramesh Chauhan to say a few words, and also thank our very, very prominent and very reputed guests who have given us really a ray of hope that everything is not lost. We still have a strong hope. We will survive and we'll fight the COVID. Thank you very much, sir. Dr. Ramesh Chauhan.
Thank you, sir. Very good afternoon. Dr. Rajan Sharma, former President, Indian Medical Association, and Dr. Vimal Vishambar Rana, sir, Head Department of Pediatrics, Sri Agrarian International Hospital, New Delhi. You both are guests, you know. We have got, you know, very heartfelt, I mean, things, you know, which we usually feel, you know, what's happening in this country and how the patients are treated. And now in the third wave, the problem of children, and in the second wave, the problem of youth, young people. And in the first wave, the problem of old people. All these things, we have discussed at large, really, I thank you on behalf of APGUL Shimla University that you have taken we have taken your valuable time, and you have spared your valuable time for this webinar. Or actually the people, very eminent people like Rajan Sharma and Dr. Raina, our teachers and our students, there are a lot of in this webinar, we have got you have got clarified many doubts of ours, and many points which I noted, that how do we expect, doctors to create infrastructure, these are very ridiculous things, how to brush aside totally the allopathic treatment, in the country, these things are actually all educated people, they know all these things, and it's very, very informative that that for future we have got certain hints, that how we will be able to isolate children, it will be a very unique situation, in the family, very small children, and at the same time, the people in the family, they have to be example, for their children, to follow all types of protocols. So I think all these points, they have enlightened us, and with the moderation of Dr. Ashwini Sharma, is a professor in the Department of General Mass Communication in APG University, and really I thank you very much, sir, both the eminent speakers. And besides, I thank my Pro Vice Chancellor and Vice Chancellor, Dr. Ramesh Kumar Chaudhary Sahab. It's only because of him, that all these things are happening here in this university, and he's the spirit behind. और हम तो थोड़े पीछे फॉलो ही कर रहे हैं. He's the actually leader, sir. लेकिन डॉक्टर रंजन शर्मा सर, आपकी बातें बहुत दिल छूने वाली लगी है. जो एक्चुअली जो सब लोग जो दिल में महसूस करते हैं, फील करते हैं, उन चीजों को आपने छुआ है. And we are really we are very much thankful to you. And in future we look forward, for some another webinar of this time, sir. Thank you very much, sir.
Bye.
Thank you so much, sir. Thank you for such a wonderful session. And we're really happy to have you here today, and the way you have guided us and the way you shared your feelings, it was really good, sir. And it is absolutely true, because even I have friends who are in the medical fraternity and they are medical officers in Himachal. So they are also very demoralized after the violent attacks on the doctors. So that's a very sad truth of this democracy that we have here. But we hope that this will heal with time, and we will definitely come out of it. So I would also like to invite Dr. Ramesh
Good evening to one and all. And Dr. Rajan Sharma ji, I have been disconnected for some time because of my poor internet connectivity. So I am not taking much time. Somehow we have been failed to welcome ceremonially to Rajan Sharma ji by the time he has not joined. So there was something, but we know we are really and Sri Venkateswara University, we have medical college also, where we are taking care of the COVID patients. So thanks to the learned Dr. Rajan Sharma ji, Dr. Bimal Raina ji, and the way you have enlightened. And I remember, Dr. Sahab, the last year when you have chaired the dais with the Health Minister of the Chhattisgarh, and other doctors were there, and that was the start of the COVID. And that time also you have enlightened the students of the university and their parents. And that has worked very well, and somehow APG Shimla University were quite safe, and we were no cases in first wave because of your enlightenment. The reason behind to take your precious time, I know Rajan Sharma ji was not good, And you be surprised or not that fighting with COVID, he was himself suffered with the COVID, and he has become a COVID positive, though being a doctor, and now he has recovered. And today also he was not well. And the way Bimal Raina ji has presented the things and shown the guide part, the best objective of this webinar was that, again, we are moving towards the unlock mode. So my thinking is that, again, we should not be very careless what we have done with the second wave. As teachers, as parents, as students, I will like to, you have listened the our learned doctors, and they have said not if third COVID will be called, it is going to come. We should think that it is going to come, and the way we should be ready. And the only is the COVID protocol is the only way to save, and then vaccination is, of course, we are going to. So this was the reason. What is happening in India and throughout the world only, that once the crisis is little bit eased, we become careless, we become very, and that way this virus is attacking. So what I am trying to, even Himachal, again, unlocking has been started. I also went to the market. Though this time I see people are vigilant, they are at least going with the mask. I myself is, carrying with the double mask. I went to the shops and they were pressurizing to take a cup of tea. I said, no, sorry. But in the last time we were taking, that time we were removing the mask and then we were mixing the people. So this is the message to all of you. I am the layman, I am not doctor, is not finally finished. Then also world will move on very carefully because we all have seen that this virus is a bit wicked and this mutating and so many things. Prachi will better understand as a biologist and the way the virus is mutating. So I'm very, very thankful. Dr. Rajan Sharma ji, I don't have a word to express my thanks and sincere gratitude. Bimal Raina ji, sir. The way you have presented is mind-blowing, and you are a very good orator, a seasoned lecturer. So I'm very thankful the way you have, and we look forward to you for your kind help always. Thank you, sir. Thank you. Thank you to all of you.
Anytime.
Thank you so much. Thank you.
And thank you to Asuni ji, the way you have moderated, sir, but you are the part of the family, so.
Thank you.
Okay.
Thank you.
Thank you.
Thank you so much, sir. With this, we end this session now.